Various symptoms of gastrointestinal bleeding. Gastrointestinal bleeding is a common clinical syndrome. Gastrointestinal bleeding refers to bleeding in the digestive tract from the esophagus to the anus and can be classified into upper and lower gastrointestinal bleeding based on the bleeding site. Approximately 60% to 70% of gastrointestinal bleeding originates from the upper digestive tract. Clinical manifestations vary depending on the amount and speed of bleeding. Generally, it can present as hematemesis, melena, or hematochezia. Mild cases may be asymptomatic, while severe cases may be accompanied by anemia, decreased blood volume, and even shock, posing a life-threatening risk. Generally, vomiting blood is a characteristic manifestation of upper gastrointestinal bleeding, usually occurring near the pylorus. As blood stays in the digestive tract for a longer period, the iron in the blood oxidizes, mixing with the gastrointestinal contents to form tarry, viscous, and shiny black stools. When the bleeding site is closer to the anus, it may result in dark red rectal bleeding or even bright red blood. However, this is not absolute. With a large amount of bleeding, upper gastrointestinal bleeding can also lead to bloody stools, and with smaller amounts of lower gastrointestinal bleeding, black stools may still be formed. Routine laboratory tests for gastrointestinal bleeding include complete blood count, urinalysis, fecal occult blood test, stool occult blood, liver and kidney function tests, and coagulation function tests. The most commonly used auxiliary diagnostic methods are gastroscopy and colonoscopy. Gastroscopy is generally able to identify the cause of gastrointestinal bleeding and is the preferred examination for both upper and lower gastrointestinal bleeding. Gastrointestinal bleeding can be caused by factors such as inflammation, mechanical injury, vascular lesions, tumors, and other factors affecting the digestive tract itself. It can also be a result of diseases in adjacent organs and systemic diseases affecting the digestive tract. Common causes of upper gastrointestinal bleeding include reflux esophagitis, Mallory-Weiss syndrome, acute erosive hemorrhagic gastritis, gastric cancer, gastric ulcers, and so on. In addition, upper gastrointestinal bleeding may also involve biliary bleeding, but the amount of bleeding in such cases is generally not large and does not typically lead to symptoms of shock. Treatment usually involves antibiotics and hemostatic drugs once the cause is determined. Lower gastrointestinal bleeding is often associated with tumors, polyps, inflammatory bowel disease, diverticula, vascular disorders of the intestinal wall, and other factors. Due to the diverse causes, careful differentiation is required. Generally, this type of bleeding rarely leads to shock. Treatment is directed towards the specific causes, and most cases can be managed with medical interventions to control bleeding.